What if the key to lasting weight loss wasn't a drug, but something natural? Something powerful enough to rival pharmaceutical results, yet derived from nature itself? A discovery at Duke University from Dr. Patrick Sullivan was made during a study focused on a compound for brain health that quickly unlocked a groundbreaking natural product for weight loss.
Patrick wisely decided to conduct some of the initial studies in mice looking at cognitive function. He placed the mice on a high-fat diet to induce dysregulation in metabolism to sort of exacerbate that phenotype. That was the serendipity that led us to pursue the metabolic effects of the product in this case.
Over the next several years, researchers performed exhaustive research studies on the naturally derived formula called Motus.
We did a second study called an intervention study where we took mice that were already overweight and then we fed them a high-fat diet with or without the product, and those that got the product actually lost weight.
Preclinical data from Motus showed results often seen in leading pharmaceutical weight loss drugs.
We wanted to compare the product to a GLP-1 receptor agonist. It's a therapy approved for the treatment of obesity. We found that the product caused about the same amount of weight loss as a GLP-1 receptor agonist in mice. And somewhat excitingly, it actually added to it, suggesting that there may be different mechanisms that allow for additivity and making it optimal to pair a GLP-1 receptor agonist with the product. Currently, we are doing studies that repeat that, and we're also looking to explore the long-term implications of supplementing with the product, particularly if one were to stop taking a GLP-1 receptor agonist.
GLP-1s are a good start and get people going on a weight loss program, but for the long term, you can't take it forever. This product will help people either replace a GLP-1 or perhaps be a great add-on to a GLP-1 that can be continued after a GLP-1 is discontinued.
The studies that we've done in terms of what the product is doing for the quality of weight loss, it seems to be very attractive. It is preferentially burning lipids at this point, or fat mass, with a sparing feature on lean mass. And so not only the quantity of weight loss would be good, but the quality of weight loss may be attractive as well.
So we're working at a cellular level. We have vitamins in there where literally the mitochondrial health is just improved. So not only are you burning fat, you're actually building and cleaning up the cell itself. So that cellular debris decreases inflammation. So it's amazing for muscle, but it's amazing for other areas as well.
History shows that people like a safe and effective alternative to pharmaceutical medications. And this product can offer that. And many studies have been done at Duke that show that this product can meet those needs.
Motus has impressed researchers, doctors, and consumers with its powerful weight loss benefits.
We're so ingrained that drugs are the efficacious way, and given the number of things that have failed to impact body weight meaningfully, it seems a little far-fetched to think a nutraceutical would have as much impact. But at this point, the nutraceutical seems to be about as efficacious as a GLP-1 receptor agonist.
All of this is natural. It's not a chemical that was made somewhere. These are things, if you could eat them in abundance in natural life, you would be able to heal yourself.
And the food industry has conspired to make us all fat and unhealthy. And so what we're hoping to do is, by taking a cocktail twice a day, that they would counter negative effects of the poison that we're eating from our food system and what we're drinking every day.
While Motus is currently available today, Tonum Health continues to explore the additional metabolic benefits the product can offer as both an alternative or adjunct therapy to GLP-1 receptor agonists.
So what we're hoping to do is continue to find on-target and off-target benefits. That includes optimizing semaglutide or GLP-1 effects.
It gives people an opportunity to maybe supercharge a GLP-1 receptor agonist for those that are not quite as responsive, or maybe allow people to take lower doses that are very sensitive to the adverse events of a GLP-1 receptor agonist on something like nausea. Or maybe it gives them an off-ramp so that when they no longer want to be on a GLP-1 receptor agonist, they have some sort of intervention that helps them control their weight to some degree so they don't rebound fully.
Motus revolutionizes weight loss and metabolic health, offering a science-backed, natural alternative to synthetic weight loss medications. Experience the difference today at tonum.com.